Yeah, Dr. Rutledge, we need a quick answer from you about the chances of bile reflux after MGB or any kind of gastroesophageal reflux after MGB. Does it help improving the symptoms or does it cause reflux? What do you say and what does the evidence say as of today?
This is a bit complicated, and you said I only have a few minutes to talk about it. But I'll say, first of all, good surgeon, bad surgeon.
Mm-hmm.
Good MGB, bad MGB. What we know, if you look at the medical literature of all the surgeons who've talked about the MGB, many good surgeons, I would say you and other surgeons who follow our technique, show extremely low incidence of bile reflux and acid reflux, and in fact, that the reflux gets better with the surgery. Now, I will tell you that there is a group of Australian surgeons, and forgive me for bringing them up, but last year, they said 1 out of every 10 of their MGBs, they call it an SAGB, 1 out of every 10 had to be reoperated on because of crippling reflux. Okay? Now we have almost none and it gets better, and they have terrible. How can we explain that? Well, just short is, I would humbly say it could be that we're fibbing about it, there's something. I say it's the technique of the surgery. So who the patient chooses for surgery, they can choose bad MGB. There is bad MGB. You don't need to say anything, but in India there are many surgeons doing MGB, some good, some bad. If you have a bad surgeon, a bad surgery, and the technique we can talk about how you make a bad MGB, you can have bad reflux. Now the second thing is, even in a well-done surgery, even in the best done surgery, even without surgery, in the United States, 1 out of every 4 human beings in the United States is taking medicine for reflux. 1/4, they don't have MGB. They don't have MGB. And we don't see 1/4 of our patients have reflux. 1 out of every 4 people in the U.S. and around the world, yes?
This is very common here in India as
and
well.
they don't have MGB. So then people have an MGB and they say I have reflux. Oh, it must be the MGB. Wait, what about the entire rest of India and the United States and France and other countries that have reported that have reflux? So here's the trick. If you eat badly, we know you can cause reflux. What is one of the number one things is just eat too much. Number one, get a good surgeon. Okay. Number one, get a good MGB surgeon. And we know good honorable people have published papers saying we are bad MGB surgeons. Now, they didn't say that. What they said is their MGBs are so bad that 1 out of every 10 had to be reoperated on in 2 years. Okay. Now, don't go to them. I don't. Forgive me.
Yeah, otherwise looking at MGB and the mechanics of MGB, we have studies from Italy from Professor Tolini. He checked the pressures inside MGB versus
in a good MGB.
Yeah, in a good MGB.
And you can make a bad MGB, and you can make a good MGB bad if you eat bad.
Yeah, so actually MGB should decrease your stomach pressure, and it should actually help in treating the reflux rather than causing the reflux.
Right.
Am I right?
If it's done correctly, and if you eat correctly. In other words, all of us, if we swallowed a block of wood, would get reflux because it's not going to be digested.
Sure, right. Thank you.